Helps us unmute yourself. Thanks for joining, everybody. There's a whole bunch of people being allowed to join via Zoom. So as soon as that slows down, we'll get started. And so just give us like 30 seconds here. Okay, I think we made it. Thanks everybody for joining us. I know 3:30 on our Friday is not a time that I enjoy having meetings. I imagine I'm not the only one in that room. My name is Jeff Sims. I use he, him pronouns. I work at KCRHA as the Senior Director for Policy, and I'll be helping to facilitate today's conversation. And then Alex, I'll turn to you to introduce yourself in just a second, but let me just give the broad strokes and I'll just turn to you. Alex is going to be running through the first several slides to give former status, expected changes, options, things like that to make sure we can have a really well-grounded conversation today. And then I'll be help facilitating the question and answer and discussion portion of it. So you're going to see some slides on screen in a little bit. I believe everyone also had a chance that on your invite it was attached. Is that correct, Alex? Did it get attached in time?
It did not get attached in time, but it's on our website. I'll drop the link in the chat.
Thank you so much. So that way, if you need to have a little bit bigger screen than what we have, feel free. And with that, I'm going to turn it over to Alex Ibrahimi to get us started on our discussion.
Thanks, Jeff. I appreciate it. Hi, everyone. Many of you know me, but for those of you that don't, my name is Alex Ibrahimi. My pronouns are he and him. I'm the System Performance Manager here at the RHA, and I appreciate you all joining us this afternoon. As Jeff mentioned, 3:30 maybe not the ideal time on a Friday. And for those of you that are not tracking, the meeting will be recorded and posted to our website, so folks will be able to reference it after the fact. If you give me 1 second, I'm going to try and share my slides.
Okay. Yeah, I'll watch chat and for hand raising, Alex, so that you don't have to do that part. And then I think we'll mostly just for the context of the group, because of the number of people that are on, I'm going to try to allow Alex to run through the first section that he and I know that he is covering. And then as soon as that's done, maybe turn to some questions there before we get into the discussion piece of it.
Okay. Thanks for that. So without further ado, we'll go ahead and get started. What we're going to be going over today is prioritization. So coordinated entry, to give a quick summary, is about access, prioritization and assessment, and then referral, which usually has a component of service match, and then housing placement with a role. And what we're really looking for today is talking about prioritization. We'll be going over a couple of different things. First part, we'll be talking about updates from the RHA, giving some context as far as the recent history, what we were doing, why we were using it, and where are we right now. And then the second half of it is going to be gathering input from you all, both in the call and on the chat. In addition, we're going to have a form available to folks to be able to provide their input after the meeting. So if you have colleagues that aren't able to join the meeting live, that's okay. They'll be able to submit their input after the fact. So first and foremost, let's talk about what we were using up until very recently, and that was known as COVID prioritization. And COVID prioritization was developed as a result of guidance from HUD and Washington Commerce in early 2020. And the prioritization methodology was based off of a number of data sets. First and foremost, the Homeless Management Information System, or HMIS. Second, Washington's Medicaid billing data. Third would be Healthcare for the Homeless Network, the Public Health Seattle King County. And then finally, King County Behavioral Health and Recovery Division, BHERD, their data set. Talking about what was available in the first one, that would be HMIS. And in HMIS, there are a number of things known as universal data elements, which are the core data points about a person's profile. The ones that were relevant for COVID prioritization are race and ethnicity. Those were disproportionately impacted by both the disease and were disproportionately showing up in the homeless response system. Households that were pregnant, individuals that were higher risk for mortality due to age, so those were elders. The other newly added one were individuals with specific gender identity. The other data that we were using were Medicaid and Healthcare for the Homeless Network data, and that's really focused in on pre-existing health conditions. And there's a whole list of them that were part of that prioritization risk factor. And then finally, taking us to the behavioral health recovery division data, we're looking at those that were at high risk of behavioral health as was showing up in the data set. So those were folks that were getting mental health treatment and were showing up for ITA calls. So the reason why we were using administrative data as opposed to an assessment is really the fact that it's non-invasive. It doesn't require a litany of questions that are potentially re-traumatizing for folks that are in crisis currently. The other piece is with integrated data, there's the ability to have that data sit in the appropriate databases without it being shared more broadly. And I think that when you get into certain situations with case conferencing, sometimes information is being shared out that maybe not be relevant. And this is something that's avoidable. And then administrative data that exists in those databases, whether it's medical, behavioral health data, it's collected by professionals in the field that are doing it as part of their regular work. So it doesn't prompt people to to answer questions that are new in regard to homeless response. And then finally, with all things coordinated entry, we have to be focused in on iteration. And one thing about iteration when it comes to prioritization is if you're using administrative data, you don't necessarily have to reassess people because the data is there. It just depends on, it's just a change of how you're using the data. Whereas if you were to have an assessment tool, that assessment tool changes, you basically cause a whole wave of reassessments throughout the community, which again can be problematic for a number of reasons. And finally, but not least or last, is more equitable outcomes. We can look specifically at the data points that are impacting people when it comes to disproportionality and focus in on those specifically without having to rely on proxies or questions. So timeline of when we were using this methodology, we started in April 2020 to develop the COVID prioritization process. We didn't implement it until October 2020. And then that ran throughout the rest of 2020 through 21. And finally, in February 22, we removed the VI SPDAT from the housing triage tool questions. They weren't being used for prioritization at that point, but they were removed entirely from the workflow. And then in April of 2022, we started to develop the second version of COVID prioritization that integrated behavioral health and gender identity. That went live in April of 2023. And then very recently, in the end of June, the COVID emergency ended, and our access to that integrated data that exists under King County's purview ended as a result. So the process we're using now is just as a reminder, what we have done is we've expanded availability into housing beyond the priority pool. So folks that are in HMIS and service providers that are working with them can nominate them to housing. We send out availability daily, and we also field nominations on a daily basis. Oftentimes we have to tie break because we get so many nominations for scarce resources, and in those circumstances we tie break based off of the following three that are listed there in descending order of priority: self-reported length of time of homelessness of the current episode, those that are survivors fleeing or attempting to flee, and then finally the unsheltered. So that's essentially what we're doing right now. And what we're also, what we're using is we're using the data in HMIS, and we're relying heavily on the provider knowledge. So that provider expertise, the knowledge that they've gathered, both of the system and resources, but also the people that they're serving based off of the rapport and relationships that they built. So Jeff, I think this one is your slide.
Yes, it is. So I did want to pause there because we're going to turn into a shorter long-term next steps and things like that for more of the discussion, where we're really eager to get the insight and the expertise that so many of you are bringing to this, so we can make sure we're moving forward with some really great policies. But before I do that, I want to see if there are any questions on the things that Alex just covered. There is one in the chat here. What happens when someone doesn't have a case manager to nominate them, Alex?
Yeah, I think that this is a common question that comes up, and it really has to do with scarcity of navigation in our community. Not only is there scarcity of housing, but there's scarcity of the capacity to help get someone into housing. And under many circumstances, though not all circumstances, the assistance of a professional who's able to demystify interlocking systems, assist with paperwork and documentation and attendance to certain appointments is really crucial to get someone housed. So the current process relies on those relationships that have been built with providers. It also provides throughput through programs, whether those are emergency programs or outreach services only, to housing, which frees up the capacity of those staff to then serve other folks that are experiencing homelessness. So essentially, the system as it's designed currently relies on a provider to help to support someone into housing.
Thank you on that, Alex. There's also one other question. It's more fundamental to just coordinated entry overall on how a person can get the info that is posted daily, the housing notifications, and becoming part of that. That was from Gabby Ulrich.
Yeah, I will post my email address at the end of this meeting. Gabby, you can email me directly. And if you are working at an organization that has HMIS access currently, we'll be able to send out that information.
The next question we had, actually, we're going to move to in just a second. So MJ, we're going to come back to you because that's a great question to talk about. And then let's see. Well, actually, well, you know what, Alex, could you so the question is about is there any possibility of reconnecting HMIS and the behavioral health systems? I know that the data linkages that we've lost, is there a chance of getting any of those back?
Yeah, that's an excellent question. I think that falls under the purview of a longer term plan. The data sharing agreement, when it came to COVID prioritization, was founded on the pandemic itself, and it's something that takes a while to develop. So I think there's a possibility, but that requires a significant amount of project planning and execution.
Yeah, thank you for that. And then similar clarification, confirming whether or not parent or child health status, like cancer, things like that, are they confirming that those are no longer determining factors for the nomination prioritization?
That's correct, yes.
Okay. There's a question about intentions to increase navigation services going forward.
I believe that would fall under the program team at the RHA. I don't have any information to share at this time.
Yeah, I don't think we have information on that at this point either, but obviously, we're aware of needs throughout the system. And then there's a question clarifying what currently is being used in HMIS still for this prioritization.
So what essentially is being used is those three items I described a couple minutes ago. So length of time of the current episode, those that are survivors fleeing or attempting to flee, and then the unsheltered.
Ellie, if you were looking for something more clear about that, please chime in again. Can they nominate clients in transitional housing that require, make sure I'm reading this correctly. Can we nominate clients in transitional housing that require permanent supportive housing?
This is a significant sticking point. Currently, with some exceptions, and I'll speak of the exceptions first, veterans that are in VA-funded transitional housing and young people between the ages of 18 and 24 that are at imminent risk of losing their transitional living program or their transitional housing placement, those folks are eligible for coordinated entry. Other transitional housing residents are not currently eligible for coordinated entry. And really what that's based off of is the eligibility for the housing resources that we've referred to. They often exclude residents of transitional housing.
Thank you for that, Alex. I didn't mean for it to go this way, but I see we are already in a pattern where people are just putting their questions in chat and then I'm reading them as they get through. So we're kind of queued up that way. I do see that. So I'll get to those in a second, but Tina, I saw that you also raised your hand. Want to make sure we cover that.
Thanks, Jeff. I just wanted to check and see. So I saw someone's comment about the unsheltered. Alex, can you help us, or me at least, understand the prioritization of that? Because that keeps people in shelters longer than, right? So I'm just wondering around the mentality of that versus people who are in shelters and getting some of that support naturally going into housing versus straight, from other options. Not that it has to be either or, but if there's a preference, I worry about never moving anybody out of shelter.
Alex,
Yeah,
Alex, before you
go
chime
ahead.
in, I want to note that one actually that ties in really, really well with something in the chat too about asking if unsheltered just means connection, not connected to a shelter service, or if it only means like you're in a street tent or on the street in a tent or in a vehicle.
Got it. I'm going to take the second question because it's a definition question first. So when we say unsheltered, what we mean is, are they staying in a shelter? And this information is gathered from the navigator. So if you're a navigator in the community and you're supporting an individual or family experiencing homelessness and you're filling out the nomination form, you're the person who's saying whether or not someone is currently spending the night in a shelter. And I say that specifically to distinguish, oftentimes in shelters, there may be an enrollment that may not necessarily tell the truth of where someone's staying tonight. And we want to make sure that we honor what's actually happening on the ground, and the people best positioned to be able to share that information are often navigators. Tina, throughput through shelter, throughput through emergency services is crucial for whole system efficacy. When I talk about those three tiebreakers, they're done in descending order, and that's intentional. So primary is length of time of the current episode as self-reported, and then secondary would be survivors, and tertiary would be folks that are unsheltered. More often than not, everything hinges on the length of time of current episode under this current structure. So there we have seen, anecdotally, I heard just a couple of minutes ago, significant throughput through shelter programs. So if you're encountering something to the contrary, I'm interested in exploring that a little bit more. But I concur that throughput is important.
Yeah, I want to clarify, Alex. I'm not saying that that's happening. I just want to ask about the mental or the philosophical approach to it. So, because I'm sure I'll get asked.
Perfect. Well, thank you for that. Let's see. If someone needs housing in order to be on a transplant list, does that have any impact in helping them find housing?
I'm sorry, Jeff, was that if someone needs housing in order to be on a transplant list, so list for
Yes.
a donor organ? Currently, no. Again, the tiebreakers which are impacting who's getting matched to housing are those three that I listed a few minutes ago.
I'm sorry, I meant he needs a housing to be on a transplant list. So
Yeah.
I've been nominating him and he's not being picked. But I mean, he's done talked to Naika, he done made complaints, he done wrote grievances, he done did everything he could because he thinks that I'm not nominating him. I mean, I'm not trying to get him housed. And I told him all I can do is nominate him, you know, and Naika helped explain that to him too.
Yeah. I think that this is exactly why we're gathered here, and why we're asking for input. You know, I'll state for the record, as someone that's been involved in prioritization design over the many years, it's never an enjoyable experience. It's a gut-wrenching experience trying to differentiate what factors and what characteristics of someone's experience are elevated above others, because to state the obvious, everyone deserves housing, and there should be no situations in our society where someone has to find housing, period, and certainly not to receive a life-saving medical procedure. And again, that's the reason that we're here today, is to get that input, to get that feedback, to gather it and consolidate it, and to have it impact the planning. And so I would suggest that you share that input in the form if you have the time.
Thank you for that, Alex.
I'm sorry, excuse me. On the form, you said on the form, I don't see anywhere where you could put that on the form.
To be clear, we're asking for input on prioritization, and there's another form, so not the nomination form.
Okay, so
and I'll share that with.
Okay, thank you, sorry.
No problem.
There's several more questions in the chat here, but they largely are shifting into what we wanted to cover next as part of the broader discussion. So I'm going to put a pause on those for just a moment, not to ignore them. We will cover you in just a second, but wanted to run through just the next couple things. So first, short term, what we would like to see in the next 1 to 3 months. Well, this is part of our first step with that, and asking for the feedback here, and then like getting a sense of like what your input is on what we should be using for prioritization, tweaks that we need, things like that. Alex, is there anything you want to add to that, that general statement?
No, I think you got it, Jeff.
Okay. And then if you go to the next slide, which is just going to be longer term, it's really just a time difference there. What are we, and this is kind of our second question for you, is what would you like to see in the next 4 to 12 months? So we're really asking for both. What do you want? What is the input you all have for a short term kind of a thing? And then thinking more of in a long term capacity, please kind of try to bifurcate your feedback for us there. Though a lot of topics might overlap. And then just briefly wanted to run through what some next steps will be. Actually, let's go through the next steps after we go through some of these questions that have been already posted. I think that makes the most sense. I'm going to dive back into our chat where people put a lot of questions. Though feel free to raise your hands too. So the first area is actually around are barriers to housing being considered, and this is from Barbara. Barbara, if you want to chime in with a little bit more about that, and especially thinking about that 1 to 3 or that 4 to 12, if there's anything more you'd like to offer as feedback or any more detail you want to give.
Excuse me. I'm just thinking about how sometimes there are clients who may have like eviction histories or like particularly unsheltered clients who have like pets, and how that's being navigated with prioritization. That's like a huge, especially in Seattle, and generally this region, there are a lot of folks with dogs and other pets, and I'm trying to, and I apologize, I got in the meeting a little late, so it might have been covered. But I want to know how we're helping people not be separated from their animals, particularly when those animals are a part of their families, and how that impacts this work.
Yeah, I think that given where we're at this moment is trying to take some feedback and about like what kinds of things we should think about for our implementation, next steps or adjustments. So I think that would transcend both of those. Is how do we consider some of the points that you're raising about housing barriers, troubled rental history or housing stability history, and then pets or other household factors. Does that sound about right?
Yeah, and I think there's two things in like on my mind is how do we get people moved in, right? Like is the pet a barrier because of the housing market and what we have available, but also things like I've been hearing a lot from folks about like, well, if there's not a designated smoking spot, people are going to still smoke cigarettes or other things. Like, where will they go? Will they lose their like housing if we put them in somewhere that doesn't have a location like that or stuff like that? So I'm happy to provide feedback in a form with what I've heard over the last year or so. So yeah.
Sounds good. Thank you. I'm going to start parking. I see a few different hands going up on top of the questions. We're going to try to make sure that we move quickly and really allow as much input as possible. These next two are less about our questions about prioritization or more about other points. So I'm going to put them in a parking lot and come back to them in a minute. The first is around nominating people for housing. They never get a notification that they've been rejected, why that's the case. And then the second is for people that are chronically homeless, Oh, the second one was after noticing that people that if a person was not active in the system for more than 90 days, after 90 days, they're automatically exited. They thought they'd stay in the system until they're housed. So we'll come back to those as kind of separate but related issues. Ellie, you made a comment about people who are experiencing chronic homelessness, but sometimes their episodes of homelessness are short and would not reflect the length of homelessness. And that sounds like an feedback on both the short and the long term, but I wanted to give you a chance to chime in on that.
Yeah, I think that the idea of prioritizing the length of time homeless makes sense, but it also doesn't always reflect someone's actual experience with homelessness. And so, for example, especially when young adults are kicked out of transitional housing programs and they're exited, their new length of time homeless could be 2 weeks. And so now they're in a position where they have less of a chance to be prioritized, even though maybe a brief stay in a transitional living program kind of now has disrupted their total time homeless. So that's what I'm getting at.
Gotcha. Yeah, thank you for identifying that nuance and what we need to be considering. Alex, did you have is there anything already underway to kind of address that, or is that just something we need to take in as that's the kind of feedback we're looking for?
This is exactly the kind of feedback that we're soliciting during this space.
Yeah, that's what I was thinking too. So thank you for raising that. I'm going to go with a few hands because I'm getting behind on them. Janice.
It's Janice, but that's
Oh,
okay.
I'm sorry, Janice.
That's all right. So this is a question that's always on my mind, and I know Alex know I'm kind of going to go there a little bit. But I'm wondering, how is the data influencing people being prioritized in terms of race? I want to know, out of all of the data we collect and we have to put in the system, what is informing the system about who is furthest away from opportunity and equity? And will that be something that could be utilized to inform the system on what needs to go next? Just something to think about.
You're on mute, Joe.
Yep, I caught that 2 seconds in. Thank you for flagging that. I know that in past revisions with coordinated entry, that's been something we've looked at, is disproportionate ways that we are perpetuating disproportionalities and inequitable systems, and and it sounds like what you're asking us to do is, as we are looking at these, both in the short and the long term, make sure that we're looking at that, taking that data and figuring out like, okay, how can we do a better job, which is something that fortunately we have done in other circumstances, and we just need to keep that moving.
Yes, I think that's very important.
Perfect. Thank you for raising that. Absolutely. Tina.
I just wanted to comment. Hi, Janice. Barbara, your comment that you had, Alex knows I popped in the other day into one of the case conferences or care conferences, whatever they're called. And I would really like to, see lots of participation in those. I mean, if I had my way, so that people who are making referrals can talk to the people who are offering the housing. And maybe Janice, it even kind of speaks to a little bit about what you're talking about as well. Because as the housing provider, we can't select, we can't deny all those things. But if you can ask us the questions about what it is that we're providing, what location it's at, is it good for this? You can ask the questions about what this housing does to provide the needs for your clientele. Like, can they have pets, and we don't allow pets, but you could get this for a companion animal and those things. So you can make proper referrals to help expedite eligible people to get housed, and also reduce the trauma of people that get housed or get referred and even maybe get housed, but it's not the right place. And I'm just going to speak candidly, because I know we don't select and all those things, but the truth of the matter is there's a variety of different housing providers. Some are better providers based on the needs of clients than not. So if we are just getting people in to get a roof over their head, that's not the right space for them, and it's a setup to fail. We're re-traumatizing people, and we just have to have some honesty about that. So yeah, I would like to just see an increase in those dialogues and conversations, and relationships matter.
Thank you for that. It sounds like that's a piece that is related to what we're talking about, like the need to have that other information, know that we're doing a good job, that our matches, our nominations to those matches are correct and really well suited, but it might not be exactly the list that Alex just went through, but that doesn't make it any less related. Crystal.
Hi, thanks. I just had a couple comments. One, can you hear me okay?
Totally, you're great.
Okay, great. One comment is something I'd like to see in how coordinated entry functions is more collaboratively with other service providers. So like, for example, instead of like competing for, you know, like one agency has a client, another agency has a client. If we have the same client, we're working more in a collaborative way to get that client housed instead of, you know, more of this like competing for resources. That's just one comment I want to make. And then another thing on the length of homelessness, we're noticing some of the folks that we're bringing in from encampments have never had any access to services, and sometimes it's their first time being enrolled into HMIS, but they have long-term chronic homelessness. So that first prioritization of length of homelessness sometimes can be skewed. I think somebody else said that earlier, and I just wanted to flag that as well.
Thank you for that. Yeah, that's an interesting factor we need to consider with how we're measuring that and how we're doing that tiebreaker. Catherine, you had your hand up for a second. I don't see it now. So I'm going to move to some in the chat, and then if you have a question, raise it again. Though, the first one, this is from Laura. Is there any discussion in terms of corrections clients that are placed in DOC-funded transitional placements being nominated for housing? It seems like that might be. I'm thinking that's probably one of our parking lot issues that maybe we'll come back to if we have a chance. So because that's not totally on the prioritization piece itself. But Alex, can you talk about anything? Or is there anything else further you would want to say, Laura, I should say, about corrections, criminal system, and justice system involvement, things like that you wanted to put a finer point on?
I have a horror. All of my clients are DOC clients, and I can never get because they automatically from the gate get placed into transitional housing because it's a directive of the state that they get housed as part of their DOC release. Some of them will get eventually into shelters, but a lot of them go right from the gate to transitional housing, and it's only 6 months. It's not like they can be there for a longer period of time or any of that. So it's a system that just keeps it keeps us away from being able to house them through coordinated entry. And a lot of clients need permanent supported housing. They're not, entirely stable when they release, and they're struggling with substance use and mental health, and it's just one more system that stigmatizes them for being justice involved.
Thank you for adding that. That actually did really tie in a lot with what we're looking at and some nuances that we need to make sure we're considering in terms of people getting automatic placements into transitional housing and just transitional housing overall. Yeah, go for it.
I just want to, Laura, that this is a well-known challenge, and it ties in with the other stuff I shared related to transitional housing and time limited programs. This is something that HUD needs to shift before we'll see significant changes for folks that are in transitional housing. So I would encourage folks that are interested in this issue to elevate that to HUD.
Okay, perfect. Thank you.
Yeah. Alex, I'm going to go back to you in just a second too. This is asking for clarification on what you already covered. When an individual is marking unsheltered, does that mean they are staying in Well, let me just read the question. For clarification, when we are nominating, marking unsheltered means they are, quote, staying in shelter, unquote. But could you just provide clarification?
No, it's the opposite. So if you're staying in an emergency shelter, then you would be, in this sense, sheltered. If you are not staying in an emergency shelter, and you would be unsheltered, sleeping in a place not meant for human habitation, in a tent, on the sidewalk, in a vehicle, squatting in a building that doesn't have electricity or running water. These are all versions of unsheltered.
Yeah, thanks. I thought that maybe I was reading it wrong, but it sounds like you heard it the same way I did. Let's see, is pregnancy no longer a priority as well? Can you just quickly respond to that one as well?
Correct.
Okay. Let's see. I'm going to go back to the hands while I read down the list a little bit more. Is it Dewey? I might not be
Yeah,
seeing-
it's Dewey. Yeah, no, you're good. I had a quick question and then a quick comment. My question is, prior to the data use agreement not being in place anymore, I believe that KCRHA was using HMIS to gather demographic information to do that prioritization on both racial identity and gender identity. Is that still not feasible since KCRHA still has access to HMIS basically? I don't know if there's some other reason why we're not using that, but I respect that we were prioritizing people who are disproportionately represented in homelessness using the racial and gender identity. So that's my first question. And then my quick comment is I echo a lot what a few other providers are saying about making, effective referrals, or essentially saying that we want to match the person to an appropriate level of services at the housing. I also think that there's work at the RHA end. I also think that as service providers, we want to have some sort of shared framework and knowledge and some responsibility to have that knowledge. And so I would love to think about some sort of training or informational document to have a shared understanding of, what an individual needs and like what housing services or what housing resources would be appropriate.
Thanks, Dewey. So I'm going to go with the first thing that you mentioned, and I'm going to also say hello, Janice. It's good to hear from you and see you briefly. Since when it comes to equity, neutrality is actually harmful in my opinion. I'm not going to be neutral here. Racial equity should be a primary concern for all of us when it comes to our work, and it certainly is something that we are soliciting input today on prioritization. If you concur with that, this is also the opportunity to share that particular bit of information with us. However, before the implementation of COVID prioritization, I also want to give credit where credit's due and honor my colleague Janice, who was on the policy advisory committee when we were developing COVID prioritization and was a voting member when we passed it. Prior to COVID prioritization, we were not using race and ethnicity as a data point for prioritization. In fact, when we went live with COVID prioritization in October 2020, to the best of my knowledge, we were the first COC or CES in a COC to use race and ethnicity explicitly in the nation. So there is precedent with COVID prioritization, but there's no precedent preceding it. And regarding your second point, I believe we have had conversations about this thing, and I couldn't agree more. There needs to be a better service match. And part of the ways we get there, not to take us off topic, is by education. So I completely agree with what you're suggesting today.
Thank you, Alex. Good to see you.
Alex, there is one clarification on what you asked or what you stated earlier. If someone was prioritized on the previous priority pool, with how things are happening now, do they maintain that prioritization?
Yeah, they maintain their connection to navigation, and they do get a prioritization over folks that were not previously on the priority pool. So priority pool was a small subset of folks that were prioritized using COVID prioritization. Until we house them all, that they're going to have priority over new nominations. And that just speaks to some consistency with system changes over the years. We maintain the commitment we make to folks that we're going to house them.
Thank you for that, Alex. There's a few more things that I'm going to put in our parking lot. There was some comments about mobility transfers, some comments reinforcing some of the earlier statements about transitional housing, a request that we share the unit size on the daily notifications as well, so a possible tweak in that space. A request if we're still accepting HMIS agency request forms. If you have that handy, maybe you could drop that in the chat, Alex. And then I'm going to ask Ellie, you had two different pieces in here related to youth and young adults, and I was wondering if I could just turn to you to ask your questions. I don't want to try to synthesize those. There's a lot in both of them.
Yeah, and I apologize. I got kicked out of the meeting for a moment, and so I lost my comments themselves. And so some of the things that I guess I see specifically in the young adult space is that we're prioritizing based on like high vulnerability, but our resources aren't reflecting the support that some of those high vulnerability folks need. And so sometimes they end up being nominated for the resources, but they're not a good fit. And then that like is what leads to a lot of exits from TLPs. But then also those who might be able to utilize that TLP space, their length of time is often shorter, like they have less of those vulnerability factors. And so they're a less competitive nomination. And so I guess for young adults in particular, because those resources are so specific in what they provide in terms of support, I don't always feel like it's a good fit. That was one of the comments.
Gotcha. Thank you on that. Yeah, that goes back to other comments we've already had about the importance of good quality matches there. And I think I would probably put that in similar category as some of the other things that we have had that I kind of parking lotted that are around they're maybe not about particular prioritization, but thinking through like how we continue to improve on our processes.
Yeah.
Go right ahead.
So other piece of that is a lot of our young adults who transitional living programs aren't going to work for them. They're looking for permanent supportive housing. Since there's not much of that in the young adult space, we end up needing to nominate them for permanent supportive housing in the single adult space. But again, in that space, they're also not a competitive nomination. They're not eligible for a lot of resources because they're not chronically homeless necessarily. And then their length of time is just naturally shorter than someone who is older. And so it just feels like a lot of those people get stuck in between the young adult and single adult space and getting the effective resource that they need.
Hey, I'd also like to challenge a little bit what you said about what Ellie said about this not quite being a prioritization thing. It is, especially in the young adult space. I agree with Ellie a lot that we are prioritizing the folks with very high mental health needs and substance use disorders and all of those things for these units, but then they are not a good match for that unit. So it is a prioritization issue for those units because the prioritized people don't actually fit that unit.
That's an excellent point. Thank you for pointing that out. I fully agree with you. Sorry, and I think I was leading us in the wrong direction there, so thanks for correcting that. Catherine, I see your hand's back up after a few minutes. I lost you earlier, so sorry about that. Go ahead.
Yeah, this is more in line with the current conversation, actually, where we're prioritizing people with some of the highest mental illness and substance use needs. But not all of the programs are equally equipped to support those people, even if the programs state that that's a criteria. It's just kind of a gap that I'm experiencing. And so I don't really know what my recommendation is there, but I think we need to be really clear about what type of supports each program does have and like who they are intended to serve.
Absolutely, and that ties right in all together. So thank you both for adding better clarity and really drawing that connection. Obviously, I missed it. I bet Alex probably caught it, but thank you for making that, reinforcing that more. There's some more parking lot items, a list of available navigators, a real-time list of who's already available, the ability to nominate people to multiple openings at once. And then the other one here is the way it's phrased is consideration of other factors for prioritizing, including perhaps a more dynamic scoring system than simply having length of time that is the most recent bout of homelessness began being the sole determining factor. So some other who put this down? Let me scroll back up. Nico, could you say more about what you're proposing here? I don't think I'm totally capturing it. Okay, I think the point though is ultimately a dynamic scoring approach rather than just simply length of time that the most recent bout of homelessness is, which others have also identified with like our chronic, like someone who's got short recent bouts, but they meet the chronically homeless definition, things like that. Is your hand back up or is that a remnant? I'm going to assume it's a remnant. Aaron?
Thanks, Jeff, and thanks, Alex. I just wanted to echo, excuse me, what Ellie and Finn had said, and say that that completely resonates too on my side of the youth and young adult housing side. I think that there's also a challenge, though, that as long as we have, like in our contracts for like housing navigators and outreach folks, referrals to programs as like a matrix that they're held to, we're gonna have the problem of people making referrals that don't exactly fit their client or their prioritizing challenges. So I think we should maybe take a look at that when we have a chance. I think the other thing too is just making sure that we have clear and open communication between the systems. So youth and young adult folks need to have a clear pathway to get to the single adult side, and making sure that those are accessible and understood by kind of all of the navigators.
Thank you for that. I think that, yeah, and also for some proposing some potential ideas that we might be looking at there. There's some affirmation in the chat again about race being included as a factor. Obviously, we've touched on that a couple ways, including also looking at gender, not just race, using our HMIS data. From Ellie, can we have an explanation of how the historically prioritization is factored into the nomination form? Does the person need to be engaged on the PP? I don't know what PP stands for.
Priority pool, sorry.
Oh, there we go.
I've often had it where I've had clients who historically they've been prioritized, but because they were not accessing services for a while, their prioritization doesn't show up as active. And so previously, when we were using the priority pool, when someone would re-enter services, and in the past they'd been prioritized, we'd have to send an email to re-engage them on the priority pool. But now what I've seen is sometimes I'll nominate a client who historically was prioritized, but recently hasn't accessed services, and their nomination or their prioritization doesn't seem to be considered in their nomination.
Hi, Ellie. I'm happy to have a more detailed conversation with you because I think that this is just a little bit off topic, but just to answer the question in a transparent manner, as I described earlier, those that were on the priority pool prior to the transition, those folks are getting priority for referrals if they're nominating to resources. That also applies, Ellie, to folks that were on the disengaged list. And that disengaged list goes back 1 year from the date that we snapshotted. There are certain activities that will take someone off of the disengaged list, like getting housed. So if they exited in the housing, then they wouldn't be on the priority pool or on the disengaged list and wouldn't get that priority if they've re-entered homelessness. But if you have specific examples, I'm happy to work through those with you outside of this conversation.
We're getting a little close to our time here, so I think we have about 5 more minutes that we can do questions for. In the chat, there was a lot of support expressed for some items that we've already have come up, focusing on pregnant women, families with major health issues, looking at race and ethnicity, the importance of appropriate matches as we're going through making those the service matches and the type of match. Now you're getting ahead of how fast I can read. You all are very helpful in giving us lots of insights here. And fortunately, we have the chat saved. Let's see, I'm looking. There's a question from MJ. Let's see. It looks like yours is related to True Blood and MID and HIV. Can a housing provider post an opening for a MID eligible HIV or True Blood class member? Does the change in access to the behavioral health system affect the ability to capture those? Alex, could you clarify that one? Because I don't know if we've lost that ability to capture or not. I'm assuming so, but.
So hi Kaiser, related to the True Blood resources, I'm aware of a section of them coming up for release up that have system connected eligibility. That's honored through partnership with the Behavioral Health Recovery Division and the providers that are connected to the behavioral health system. So while we have lost access for behavioral health data through COPRI prioritization, for basically what are amount of set-asides, we have partnerships that allow us to path folks in that are eligible for those resources.
Thank you. Let's see. The last, I'm down to the last couple comments here. First, programs that do not have resources and support for clients that they can provide. There was also some questions that I had put in the parking lot about knowing the list of navigators and being able to provide that. So I think that's something I put in the parking lot, but maybe we can follow up after this meeting, kind of providing those resources, and hopefully that would help bridge that gap. And then a couple more just popped up. It looks like sorry, I can't keep up with all these. They keep popping up and down my screen. Focusing on individuals that don't have documented status from a few different people as well. A reiteration about asking about people that are not, since we do have a minute left, some of the things that were put in the parking lot here, I want to turn to, especially ones was reiterated in the chat, asking me to make sure we cover it on the call. But before I do that, was there any other questions or feedback? Please raise your hand at this point, because I'm going to have a hard time scrolling through the chat. Okay, let me start going through the parking lot. We aren't going to be able to get through all these, but one was about when they nominate a person for housing and then they do not get a notification that they've been rejected, and asking why that's the case. And I'm assuming also if there's anything we can do to change that. Alex, any thoughts on that?
Yeah, for everyone's awareness, we take nominations through a Smart Sheets form. Smart Sheets forms can be a little cumbersome, and to give people context of scope with single adults, and this is likely related to single adults, we receive anywhere from 50 to 150 nominations a day. We are working on a way to automate responses to those folks that do not actually get a referral. At this time, we do not have that automation, and we're not able to respond back in a timely manner to close the loop on that. We recognize that that's something that's less than ideal, and we're working towards resolving it, and appreciate the patience now, but this is something that we're presently not able to do.
I will add, we had one more comment right at the end, Alex, that is very specific to the questions we were asking around just affirming that we need to consider people who are pregnant and adding priority to them, or individuals that have very young children as a consideration we need to add. Nico, saw your hand up.
Yeah, thanks. I just wanted to take a second to say, and I know we're offering a lot of hopefully helpful critical feedback, but I did want to say, I know that we're doing a lot of iterating still, but this one thing that has been really great about this process is the daily case conferencing and being able to see available units. And I know what a lift that has been for you all, and I just wanted to say thanks for all the hard work that you're putting into to make this possible for us and for our community.
Thanks, Nico.
Yeah, we always appreciate, this is a difficult domain, obviously, so we always appreciate positive feedback too on that. And I see, Catherine, it looks like you're enforcing that. Tiza, go ahead.
No. Hi, this is Tisa, and I just wanted to echo what Nico was saying. Just thank you for your hard work. This process is so much better than what it was, and I know there's still some fine tuning that's needed, and I appreciate the space that we can all come together and do that. I've been having some luck getting people into these units, and I think it just takes knowing your clients, being careful to select. I wanted to lift up, I appreciate Surya and Alex and Tom jumping in with my specific questions before I even nominate during that window to make sure my clients are going to be a good fit. And then just partnering as much as we can with our neighboring service providers is super helpful to round up that documentation when we have clients in common. So just wanted to leave with that. Thanks.
Thanks, Susan.
Yeah, absolutely. Our next question, y'all are being too nice to me today. They're asking about next steps, but those are great because that's my next slide. So Alex, could you advance for me? I promise I didn't plant that in the audience. I just appreciate it. So first, our next steps on prioritization. As you can see on the slide here, we're collecting input during this meeting, and there's also going to be an input form that you can utilize. Is that, let's see, who do I have here? Alex, do you know if it's not on our website yet, is it?
So this deck is on the website now, on the Coordinate Entry website. I'll drop the link again in the chat, but you can get to all of the URLs that will come up in a minute.
Okay, perfect. So you should be able to go to kcrha.org and navigate to that. And also apologies before this call, we were working with our comms team a little bit to make that really accessible without 30 links kind of a thing. So we'll try to make sure that is set up well for you to be able to provide that feedback and input. And then that input obviously will shape our planning. I think that goes without saying, it should be obvious. And then you can add your name to the contact list form. Oh, there we go. Alex already, actually, that's a nice, easy link to get to. Alex, can we go to the next one? So that's our next steps for actual prioritization changes and considerations. However, that we also wanted to flag that the Coordinated Entry Committee is still taking applications until October 13th. That form is on our website too. Is that correct, Alex?
It's on the deck. Yes, it's linked on the website.
Okay. I just didn't want to make people have to go through the deck to get to the links. So we'll try to make sure that that's really easy and available. Sorry that I wasn't able to check that beforehand. Applications are reviewed between the 16th and the 19th. And then the first meeting of the Coordinated Entry Committee is on Thursday, October 26th. And the regular meetings of that group are every fourth Thursday of the month. And then now the links. That's our next slide.
Now, yeah. And I will put them more easily so folks don't have to go through the deck.
Yeah, also, I don't know that I was not able, these are not set up as actual literal hyperlinks right now. What you have to do is copy and paste them into your browser. So we'll try to set up a means by which you can just go and click something and not risk, missing 5 or A at the end of some of these. If that is going to wrap up our session today. Oh, Eddie, you've got your hand up. I don't want to leave. We've got a minute or two.
Just a quick question about the application for the committee. So that application was open, I don't know, like probably 6-8 months ago too, and there was applications that were submitted. Do people that had submitted applications prior need to resubmit, or are those applications still kind of in the queue?
Yes, and Eddie, I tried to put a little footer at the end of this slide, but yes, exactly.
Oh, I see it
what
there
you said.
now. Okay, thank you.
Always read the fine print, I guess, right? The truth is in the footnotes. Thank you for asking anyway. I'm glad you confirmed that, made it clear for everybody. So on Alex's behalf, but also for all of RHA, thank you everyone for participating today, for your honest feedback, and just being our partners in all of this work. We really appreciate all of the work that all of you are undertaking, and have a great weekend. We'll talk to you soon.
Goodbye.